the theme of this entire gathering this year, that cancer doesn't just listen to a surgeon. Cancer needs an understanding of an imaging, cancer needs understanding of genomics, cancer needs medical oncology, cancer needs radiation therapy, and cancer needs coordination, and cancer needs listening to the patients. This meeting, you will hear from a medical oncologist, you will hear from a radiation therapist, you'll hear from a sexual medicine person who will help in understanding how to heal.
One of the things that creates a great surgical program is this back and forth between clinical leaders that are world leaders in their specialty and an organization that tries to develop an environment to support them. Ash Tiwari has inspired me to think about, ever since I first got to know him, is to think about patients holistically, and not just in a complex hospital, but in the environment that surrounds us.
So this is our 7th year hosting this. Dr. Tiwari and I started this a while back, and every year the goal is to grow it and to stay relevant, right? New topics, interesting topics, things that are going to impact patient care and research. This year we're doing the same thing. We're focusing on prostate, kidney, bladder cancer, but the holistic approach to it. Obviously, the backbone of what we do at this meeting is surgical. We show the robotic techniques, some of the new things we're doing, but also it's the other parts of it. The science behind aggressiveness, the longevity, right? What you can do to live longer, to live healthier.
The bulk of the symposium focuses on the surgical virtuosity of using the robot, but it goes beyond that. It goes to the basic science. We had 2 Nobel laureates talk about their work and how it relates to prostate cancer. It goes to humanity. Dr. Tiwari talked about his mobile unit and how taking screening to the community has moved the needle in terms of the diagnosis of prostate cancer. And then it goes to friendship. All the people who came in spite of multiple conflicts and all of that, people who admire the work that Dr. Tiwari has done and that has come out of Sinai and want to be part of it, much like I do.
The surgery today by Dr. Tiwari was amazing. That definitely will be the highlight for me, but I'm also looking forward to the breakout sessions and the poster sessions to talk a little science as well.
Last year, students just attended to view the talks and just learning, but this time they are presenting and they are sharing their science with the bigger audience.
I'm a surgeon, but I can learn from someone who is an expert in pathology, someone who is an expert on MRI, someone who is an expert on robotics, and nowadays someone who is an expert on AI. Putting all the experts together in one room, talking about one unified problem, that how to make things better for patients with prostate cancer, I think we come up with a better answer. Nothing beats the proximity, nothing beats the human contact, nothing beats shaking hands.
You can meet people from anywhere on the globe working in the very same specific field.
So a fantastic opportunity to get educational surgery. Lots of surgeons from Europe are coming and showing their best sort of effort and interest in surgeries.
It's truly international. We have speakers from really all over the world coming here today. And today, I think one particular highlight was we had Nobel laureate Harold Varmus giving a talk that I thought was really big picture, really well done.
Most of us who do cancer research feel that we've never had a more exciting time to live in.
It's very nice to get together with the colleagues and learn from them. It's interesting that within that even 12-month period, there's still new stuff that you didn't learn last year.
See new approaches, some new technologies applied to robotic surgery, urologic oncology.
It's very important for us to give us new hints, to follow new routes, and to have the possibility to have new ideas.
We have the chances to see difficult surgery happening and to share tips and tricks, and today was very interesting to me.
I think it's very interesting, a lot of great surgeons, interesting topics, so it's a pleasure to be here.
I think there's something magical about this meeting because you have the best faculty from, doing prostate cancer, kidney, Dr. Badani, Dr. Mirazin, you have Dr. Wickland who's doing bladder, and all of it is under one roof. They are showing all their skills. They're doing difficult cases. There's a lot to learn for urologists. There's a lot to learn for researchers, those doing basic science. There's a lot to learn even for patients.
I look forward to a lot of things, especially next year. We're going to host this in December, and it's going to be even bigger and better than we've already done this year.